Welcome back. January is Cervical Cancer Awareness Month, an opportunity to help raise awareness of this cancer that is many times curable. And joining us this morning is Dr. Beth Holcomb, a full-spectrum family practice physician, including OB, with the new Baptist Health Comprehensive Women's Clinic in North Little Rock. Thank you so much for joining us this morning. Good morning. I think this is such an important topic because so many people could potentially have this. We were just talking about this during the break, and they don't even know that they have it. So talk about, first off, who all is at risk?
So anyone with a cervix is at risk.
Okay.
Cervical cancer remains the third most common gynecologic cancer and the fourth most common cancer in females. We see a little over 11,000 cases and 4,000 women die annually in the United States of cervical cancer.
Wow. Are there any symptoms?
So early on in cervical cancer, we really don't have any symptoms. In invasive advanced cancers, you can have abnormal bleeding, abdominal pain, pain during intercourse, but not a lot of symptoms. And so that's why it's so important to see your physician regularly, annually, to discuss this and to make sure that you're meeting guidelines.
Yeah, and get those pap smears, which I know a lot of people hear that and they're like, oh, I don't want to do it, but it is so important because it can be, the way to prevent this from happening.
So pap smears with HPV testing is absolutely the way to go. Primary prevention with HPV vaccination, and then secondary prevention with screening. Pap test, which is where we just look at the cervical cells under a microscope to look for abnormalities, and HPV testing for the types of human papillomavirus associated with cervical cancer has decreased mortality, has improved outcomes, and cervical cancer is a treatable condition nowadays.
It's just catching it early. Really quickly, talk about how Arkansas looks when it comes to cervical cancer.
So we are doing better. Our numbers have improved. However, we are lagging behind in prevention, specifically primary prevention with vaccination. So I would encourage everyone to see their doctor yearly, meet those guidelines, consider the HPV vaccination, and that can start as early as 9. Guidelines say, hey, by 11 or 12, go and do this. And it's a 2-shot series if it started below 15 years of age.
Wow. So get vaccinated, talk to your doctor about this. Thank you so much for joining us this morning with all the great advice. Yes. Well,